Hello, everybody. We are going to tackle tonight the kashrut of medicine and go in to talk about all manner of situations and go from the most situations where you have someone who's in a life-threatening situation to people who are seriously ill to someone who just wants to take vitamin pills and supplements to the case of toothpaste. Can I brush my teeth? Does it need to have a hechsher? We're going to cover all of those things tonight. And we're going to begin with the Gemara in Masechet Pesachim, Kaf Hei Amud Aleph. And it talks about whether you can use, what things can you use as medicines? Do they have to be kosher? So the Gemara says, Amar Rabbi Yaakov, Amar Rabbi Yochanan. Bechol mitrapein. You can use anything to heal, chutz me'atzeh asherah, except for wood which has been used as an asherah. An asherah is a form of idolatry. Says the Gemara, hechidame, what's exactly the case that you're dealing with? Inema, if we want to say the ikar sakana, that we're dealing with a life-threatening situation, then I should be able to use even wood from a tree used for idolatry. And if there is no situation of a life-threatening, it's just that someone is seriously ill, but it's not life-threatening, then even all the prohibitions in the Torah, none of them should be allowed to be superseded to do their refuah, to do the healing. Says the Gemara, Le'olam de'ika sakana, yes, we are dealing with a case where it's life-threatening, and even in that situation, one cannot use the wood of an asherah. So what do we learn from this? That if one is in a life-threatening situation, I can use absolutely anything except something which has been used for idolatry. Everything else I can. So what about every other scenario where one is not in a life-threatening situation, but it is serious? What's known as a choleh she'ein bo sakana, a person who's seriously ill, but it's not life-threatening. What then am I allowed to do? Okay, can I take something there which is non-kosher? That would be a normal lav, a prohibition of Torah. Is that permitted? So the Gemara brings the following scenario. Again, this is related. It's on Kaf Hei Amud Bet this time. The following side, the same folio in Pesachim says Mar Bar Ravashi. He was Ashkechei Ravina. He found Ravina. Deshayef la lebarte begur harke de orla. Mar Bar Ravashi found Ravina rubbing onto his daughter unripe olives, which are known as gur harke of orla. Orla is something which is the first 3 years of a tree. The first 3 years you cannot have its fruits. So in this case, the olives cannot be eaten for 3 years. And not only that, normally we would say you can't get any benefit from them either. Says the Gemara, Amar Le, he said to him, Amor de Amora Banan B'Sha'ata Sakana. Do we say that when the Hachamim, when the rabbis said that one may derive benefit from such a prohibited item, that was only at a time when it was life-threatening? Shelo B'Sha'at HaSakana Mi Amor. But when it isn't life-threatening, did they permit it? Amar Le, Ravina said back to Mar Bar Ravashi, Hai Ishta Samirta Nami Keshata Sakana Damya. He says a high fever is like is similar to someone who is in a life-threatening situation. Alternatively, Ika da Amre, another version of the Gemara, Amarle mide derech hana'a ka'avidna. He said to him, am I deriving benefit in the normal way? No, I'm not doing it in the normal way, because no one would take olives from an orla, from this tree, and rub it as a medication. And therefore, that's why it's permitted, even if it's not life-threatening. So here we have two versions. The first version seems to say, anything which is similar to a life-threatening situation, then I could do something if it's not the normal way of doing a medication. For example, rubbing olives of orla on one's skin. The other version, which is far more permissible, the second version is saying, no, even when it's not life-threatening, since it's not the normal way of using the olives, not the normal way of using the olives, making it into olive oil or eating the olives, since one is rubbing those olives onto one's skin because the person is sick, it is permitted, okay? Which is a far more permissive position. The Ran explains that although deriving benefit from a non-kosher item, or item from which deriving benefit is forbidden in an unusual manner, is still rabbinically forbidden. But because we're dealing with sickness and illness, the rabbis are lenient in this case. It doesn't mean, by the way, here's a way of getting around it, eat the food in an unusual way. No, that's not what we're saying. We're saying in the case of sickness, one can do so because the rabbis were not going to prohibit this situation in a time of sickness. As it says here in source number 3, Afagav debirabanan miha asur, even though it's rabbinically prohibited, b'makom choli, in the case of sickness, lo gazru barabanan, our rabbis did not make such a gezerah, a ruling, b'isturei hana'ah shel divrehem, when it was only rabbinically prohibited to derive benefits. Miha mashma, therefore, what do we learn from this? What diuk can I make? What inference? The mitrapein b'isrei hana'ah shel divrehem, that we can what? Cure a person using an item from which it is only prohibited rabbinically to derive benefit. It's a little convoluted and complicated, but let's see how Shulchan Aruch codifies this. B'shar isurim mitrapeim b'makom sakana, afilu derech hana'atan. When it's a life-threatening situation, I can use all these types of prohibitions even in their usual way. For example, eating the olive oil or using the olives. However, shelo b'makom sakana, but when it's not life-threatening, I can't do it the normal way. Kederech hana'atan asur, the normal way of getting benefit, I can't do. Shelo kederech hana'atan, but if it's not the usual way, for example, rubbing the olives onto the skin, mutar, that is permitted with the following exceptions. Chutz mekelei hakerem ubasar b'chalav she'asurim afilu shelo kederech hana'atan ela b'makom sakana. What are the only things which I cannot use? A mixture of meat and milk, kilayim from the vineyard, and they are forbidden even when used in an unusual manner of benefit, except if it was a life-threatening situation. Based on this principle, Rav Shlomo Kluger permitted a person who's in a non-life-threatening situation, what's known as a choleh she'ein bo sakana, to drink non-kosher fish oil, since that is not considered to be a normal manner of consumption. This comes up a lot. Rabbi, can I take fish oil supplements? And I always tell people, if you can get it with a hechsher, you get it with a hechsher. But if it's not possible to get it with a hechsher, if you are sick, even if it's not life-threatening, but your doctor tells you you need to take it, If you cannot find it with a hechsher, you are allowed to have these oils, even though it may well be that they come from non-kosher fish, even shellfish, as we see here. And we can see this one in English. Concerning whether one who is in a lot of pain is permitted to drink non-kosher fish oil as a medicine, in my opinion, it is permitted for a number of reasons. It seems that to drink oil is considered to be an unusual manner of benefit, and benefiting in an unusual manner from a forbidden item, which is only rabbinic, is permitted even for those who are not dangerously ill. So this isn't just something which we say in that situation, in life-threatening. We're saying this is even if someone is just sick and the doctor is telling them this is good for you. The Rama cautions us though, and he says that we need to be careful, and that's what he says. If you can find a kosher equivalent, then you should look for the kosher equivalent. Even if it's hard to go after it, one should do so. But if one does not exist and the only treatment is this non-kosher fish oil, you could use it. Says the Rama, ve'ein matirin shum davar isur lechole im yuchal la'asot harefua beheter kamo be'isur. One does not permit anything which is forbidden for a sick person if one can find a kosher, a permissible kosher alternative. But even if one has to wait a while, even you have to wait a while to find this permissible item, since there is no life-threatening situation. So as follows, if you can't find it, it doesn't exist, then it's permissible. And this is a very interesting scenario that in Israel, it's very easy to find kosher alternatives to a lot of these medications, but sometimes here it is not so. And so therefore, if it's impossible or very, very, very challenging to find a kosher alternative, one can have the non-kosher supplement because it's impossible to find it. So according to the sources we have seen, it would seem that one who is ill would be allowed to swallow a pill that is bitter and contains non-kosher ingredients, or at least doesn't even have kosher certification, when no kosher substitute is readily available, since one does not benefit at all from its taste. So if something is bitter, and this is the whole thing here, if I'm eating something which is bitter or something which tastes disgusting, like a lot of medications used to, then I'm getting no benefit from tasting it. What we're going to get into is, what about the situation where something tastes nice? Can I have that as a medication? If you have a look at some of these footnotes here on 1 and 2, this is the approach accepted by other contemporary poskim, as well as Rav Shlomo Zalman Auerbach and Rav Moshe Heinemann of the Star K. Basically, if the non-kosher ingredients taste disgusting, then if one is getting no benefit from it, one is allowed to have it as a medication. And this seems to be the common practice among observant Jews. See footnote 2. Rav Jachter also discusses another potential room for leniency. He notes that many of these medications may be considered nifsal me'achila. They're not even considered edible, which may render them permitted to consume. Although some achronim, such as the Sha'agat Aryeh, hold that even medicine is still forbidden due to the principle of ach shaveh, where the person is thinking about taking them, and we'll go into it. But the consensus of the poskim, including Rav Moshe Feinstein, very important for the Ashkenazim, especially in the United States, and Hacham Ovadia Yosef, very important for us Sephardim, is that medicine does not taste good, would be permitted. Regardless, Rav Jachter notes that some poskim, such as Rav Shlomo Zalman Auerbach and Rav Heinemann, consider the possibility that medical pills or vitamins may be considered edible due to their nutritional or therapeutic value, or the fact that many substances in the Gemara are considered edible that we would expect would be entirely inedible. So what does all that mean? And this is what I want to clarify, because this is what I do before this class came up, before I was looking at all these makorot. Here's how I learned in Kolel. And it's exactly the way the Hamcham Ovadia and Rav Moshe Feinstein position. If it's a pill, which is tasteless or even bitter, just a plain pill, something I'm going to swallow, one does not need to find a hechsher, it doesn't need to have a kosher symbol, it doesn't need to have kosher ingredients, because all one doing is swallowing it, one gets no benefit from it, it's not considered food, and that's the normal position both for Ashkenazim and for Sephardim. Okay? I'm going to take questions in a few minutes. I just want to finish this whole section. Rav Yisrael Belsky, though, with regard to this specific case of hard gelatin capsules that are swallowed, he permits. But what about soft gelatin? Okay, so let's have a look at this in his OU Halacha Yomit. He writes, regarding medications that are encased in hard gelatin capsules, such as capsules that are commonly used today for antibiotics, Rav Belsky said that the custom is to permit them for a chole, for someone who's sick. This is based on the concept that a chole is permitted to consume non-kosher medications, provided that one does so shelo kederech achilato, that he's not doing in the normal way of consumption, that is the way when you swallow something, that's not the way that normally one eats. What normally one was eating, one is chewing it, one is enjoying it. Since it's uncommon to eat dried out plastic-like gelatin capsules, one is ill is permitted to swallow them. It should be noted that this leniency only applies if a kosher alternative is not available. Thus, as an example, one should not swallow Tylenol capsules since Tylenol tablets are readily available. Now, regarding this position here in number 5, Rav Belsky is being strict here, okay? According to Rav Moshe Feinstein and according to Hacham Ovadia Yosef, so both for mainstream Ashkenazic, mainstream Sephardim, you can have regular antibiotics in the gel capsules, regular paracetamol, Tylenol, Acamol, whatever you want to call it, ibuprofen. You can have the gel caps. For Rav Belsky, he says, if you can muster it, since you don't need to have the gel caps and you could swallow just the regular pill, which takes longer to break down in your system, you should take that pill. Now, I would say as follows. If you are in a lot of pain and you need the fast-acting relief, which the gel cap does, you can take the gel cap. But if you want to be strict like Rav Belsky and say, you know what, I can handle waiting that little bit longer for it to take an effect, then you want to be strict, tavo alav bracha. You can be strict. But as I said, strictly speaking, you know, heavy hitters such as Rav Moshe Feinstein and Hacham Ovadia Yosef, they are good enough for me. But as many people have told me on and off of this forum, there are plenty of people who want to be more strict. You know, if it helps you to sleep at night, no problem being strict. Now, let's get into pleasant tasting medication. And with this, we might even get into pleasant tasting toothpaste as well as we get into it. This is important, especially for things which are chewable or helping children to take medications. Does that change it? Because there, I could be saying that I am taking the medication like it's food, and it is in an edible way, and maybe there I'm in a problem, and I shouldn't be doing that. So let's have a look. What is the halacha concerning medications that do taste good and one does swallow normally, such as liquid cough medications or pleasant tasting chewable tablets? Is one who is ill permitted to take such medications? It would seem that the leniencies discussed previously may not apply here, since they may not be considered unusual manners of consumption if they are chewed or swallowed like a normal food or liquid. If so, does that mean that they are all forbidden for anyone other than an ill patient whose life is in danger? Or might there be other grounds for leniency? So do I say, you know what, for flavored pills, it's only for the really sick, but for me who happens to be just a little bit sick, but I'm certainly not in a life-threatening situation, I'm out of luck? Let's see. Rav Tzvi Pesach Frank addresses this question, and he says that the amount of actual non-kosher substance within the medication is quite small, and certainly less than a kazayat. Although normally even a measurement less than a kazayat is forbidden to consume, what's known as chatzi shiur asur min haTorah, which is based on a Gemara in Masechet Yomah in the 8th parak. Rav Frank wonders whether in this case it might be permitted, since the reason is that one might come to consume more and thereby consume a shiur. In the case of medicine, though no concern exists that one will consume too much, since a person only wishes to ingest the amount instructed by the doctor, more than which may be harmful. We don't want to take an overdose of the medication. Therefore, there may be room for leniency in this case as well, though he does not issue a definitive conclusion. He writes here, and let's see it in bold, Lich'ora, מכיוון שהם מעורבים ומחוברים יחד, סמי מרורים ובאין יחד, הרי זה בכלל שלא כדרך הנאתן. It would seem that since they are mixed and attached to the bitter medicine, and one swallows it together, it is considered to be consumed in an unusual manner. Mikol makom, הרי בנידון שלפנינו, לכשיעורה והווה פחות מכשיעורה, בשלו כדרך הנאתן. Nevertheless, in the case before us, there is not a minimum measure present, and it should be a case that less than the measure in an unusual manner of benefit, and therefore should be permitted. But then he concludes, אבל בדבר שאינו ראוי לאכילה, ויש מניעה שמונע תאוותו מלאכול עוד, וגם מה שאכל לא אכל אלא לאיזה צורך, ויותר מזה אין לו צורך, איך אפשר לומר חזי להצטרופה? But something that is not edible, and there is something that prevents his desire to eat more, and also what he already ate, he only ate for a specific necessity, and he had no need for more than that, how can one say it should combine? And therefore, Rav Pesach Frank leaves this in a state of, probably yes, but I'm not going to say so. So the Shmirat Shabbat Kehilchata, brought down by Rav Shlomo Zalman Auerbach, suggests a different leniency for many medicines today. He says that medicine that is made edible simply by adding extra sugar does not render it an edible food. Therefore, taking it is not considered to be consumption in the normal manner of benefit. He says here, "Uvetrufot bizmaneno, b'derech klal, enzo derech achilatan." Our medications today, don't say that's the normal way of eating. That which they take the forbidden substance and they put sugar on top of it, lav klumahu, that doesn't make it tasty, because without the sugar, the essence of the medication is bitter. Gamma pirov nifsal, and therefore it is going to be broken down by a majority. Afilu machilat kelev, it's not even permitted, no dog would eat that. Umutar gam bepesach, it would even be permitted to eat on Pesach. Gach shamati me'agaon Rav Shlomo Zalman Auerbach, and therefore it's even permitted on Pesach. You hear what he just said there? Not only is this permitted year-round, and I got another reason to permit pills, so I could take my gel caps now, I can even have my sweet cough medication. What's he saying here? This isn't even something which a dog would eat, and therefore, since it's not ra'ui l'achilat kelev, whether I'm Sephardic, whether I'm Ashkenazic. This is Rav Shlomo Zalman Auerbach, not someone looking for leniencies here. He says what? It's fit and permitted to be eaten even on Pesach because it is not food. Making the pill with sugar just so I can drink it or swallow it doesn't make it food. It's not even fit for dogs, and therefore, not only can I have it year round, I can even have it on Pesach. Okay? Very timely for our sugya coming up with Pesach only 5 weeks away, just under. Another potential option for leniency for pills is based on the Gemara Pesachim that states if one wraps matzah and maror inside an inedible material and eats them, it is not considered to be a halachic way of eating, and one has not fulfilled the matzah, the mitzvah of eating matzah on the night of Pesach. Okay, so we're going to see how swallowing matzah by putting something around it doesn't consider to be eating in the normal way. The same is true of medication. If I wrap it with something, then the medication, if it's wrapped with something, I could eat it. So let's see the sugya first. The Gemara says in Arvei Pesachim, Amar Rava, Bala matzah yatsa. If one swallowed matzah without chewing it properly, b'di'avad, you've just about fulfilled your obligation. Bala maror, but if you swallowed maror without chewing it, lo yatsa, you have not fulfilled your obligation because you have to taste the bitterness. Says the Gemara, Bala matzah maror, if you swallowed matzah and maror together, Yadei matzah yatsa, you fulfilled your obligation of matzah, Yadei maror lo yatsa, but you haven't fulfilled the maror. Karchan basiv, if you wrapped it up, both the matzah in a net, or like a tissue paper or something, ubal'an, and you swallowed it, af yadei matzah nami no yatsa, you haven't even fulfilled the mitzvah of eating the matzah. So that's not even any way of eating it. And the Shulchan Aruch codifies that if one wrapped them in a palm net, im karchan basiv, ubal'on, he swallowed it, af yadei matzah lo yatsa, even matzah you haven't fulfilled, because that is not the way to do so. Therefore, if eating matzah in this fashion is not considered a halachic act of eating, then we can infer that consuming a pill containing non-kosher ingredients, if wrapped inside another material, such as a tissue, and again, I'm not trying to promote people eating tissues or paper or whatever, is also not considered a halachic act of eating and would be permitted. Chaim Ozer Grudzinski discusses this issue and notes that it may depend upon whether the principle applies as well to the consumption of forbidden foods or is relevant only to the fulfillment of a positive mitzvah of eating, as such as in the case of matzah on the night of Pesach, which is a discussion among the Achronim. However, Chaim Ozer concludes that all should agree that it is permitted in the case of medicine for one who is ill, since the food wrapped inside is also inedible. And if you see that, just the conclusion in the bold, therefore, he says, therefore, al ken nired benidon didad, in our case, de vadai mutar lerefuah lechole she'en bo sakana, da nifsa me'achila v'gam karcho b'siv. It is certainly permitted to be used as a medicine for a choleh she'en bo sakana, since it is inedible, and one also wrapped it in a net. The Sefer Kashrut accepts this line of reasoning, at least partially, and rules that one may consume medicine containing non-kosher ingredients or without a kosher certification that has a pleasant taste, e.g. chewable pills, if one wraps it in a capsule or paper, but only if there are no better options that are definitely kosher. Okay. Mutar, it says here in 13, mutar leval'an kashen atufot benayar or b'chmuseh capsula kshera. It is permitted to swallow them when they are wrapped in paper or in a kosher capsule. The same suggestion is made by Rav Belsky as well in the case of soft gelatin capsules, which in his opinion are considered equivalent to food. As he writes here, Rav Belsky felt that soft gelatin capsules, which are often used for vitamins, fish oils, and some over-the-counter medications, should not be used because the gelatin is soft and pliable. Rav Belsky was concerned that swallowing gelatin in this form might not be considered an uncommon manner. Additionally, these soft capsules are often made from pigskin gelatin and are kept soft and pliable with large amounts of glycerin. If one has no other alternative, Rav Belsky permitted wrapping the capsule in tissue paper, which is an unusual manner of consumption. Okay? And then the notes here from Turbin Rabbanan says, we will conclude this section by noting that there are many different opinions and individual considerations to be weighed, considering the issue of taking non-kosher medications for those who are ill. In addition, opinions also differ concerning whether one who is slightly ill, such one who has a headache, is included in these leniencies given above for those who are ill. It is therefore recommended that one consult with one's rabbinic authority or Kosher agency concerning particular cases, and he brings lots of footnotes there. So before we get into the toothpaste, which is another topic entirely, I just want to summarize what we've seen and what we've heard and what we've learned together. When it comes to bitter, plain tablets, ideally, of course, if you can find a hechsher, go ahead. But generally, no one is looking for a hechsher on bitter over-the-counter tablets or medications. But when it comes to capsules, whether they are hard, whether they are soft, lechatchila, best to find a kosher substitute. Bediavad, or not even bediavad, you can rely on the position of Hacham Ovadia Yosef and Rav Moshe Feinstein that it's not food, and therefore one can take these gel capsules, and one can even have chewable pills and the cough medications. If one wishes to be strict and not have the chewable pills or have the cough medication, then one can swallow them by taking a tissue paper. We're talking about the chewable pills right now. Take a piece of paper or whatever, wrap it up, and eat it that way. But again, strictly speaking, it's not totally necessarily, especially for Hacham Ovadia Yosef and for Rav Moshe Feinstein. Questions on this, if any? Nada. Okay, everyone's good?
I have a question.
Go, Sarah.
Okay, so what about cough drops? Because they're not necessarily bitter, but I wouldn't say that they're necessarily candy if one needs them because of coughing.
So great question, Sarah. So number one, I actually do consider those things candy, but I also know that there are times when you've got the worst sore throat imaginable, and it's the only thing which will give you short relief. In that scenario, though, I wouldn't say that you're in a very strict situation. And I also know that cough medication, not all of them, but there are those lozenges which are very easy to find with a hechsher. So there I would go with the Rama, who says if it's easy to find the same item with a kosher equivalent, then 100% get the kosher equivalent. What I'm talking about is when it's something like fish oil pills. I used to take omega-3 pills a lot. They're very hard to find with a hechsher. You can, but they're very hard to find. I think you can get them in Israel sometimes. But if you can't find it with a hechsher, there I'm happy to take it more as something which I'm swallowing. But regarding the cough drops, I think technically you're probably okay with it, but since it's so easy to get the ones which do have a hechsher, I recommend the hechsher. But again, I know other rabbis who would be lenient and say even those you can take without a hechsher. Steve?
If you don't mind my 2 cents on that.
Yeah.
There's 2 types of cough drops generally out there. There are those that are really like candy, and those you can get with a kosher symbol pretty easily at Dollar Tree. Then there's a type that is medicated that numb your throat. You're only allowed to take them every 4 hours, and those have actual medication in them, and they generally don't come with a kosher symbol, but they are actually a medication.
Thanks, Rabisa. So in that case, yes, that latter group, 100%. See, what did I do without the Rabisa? I'm never hearing the questions properly. Thank you for saving me. Yes, that latter group, Sarah, would be you could take, whereas the former, which was more the candy ones, those you should have a hechsher with because they're not really doing anything. In fact, I just kind of take them just as something to keep chewing. Steve, what's on your mind?
Prescription medications that your doctor prescribes for you and tells you need to take.
Oh, so there you're moving into far more easier territory. I was just getting into, so let's just go a couple steps. The areas where there is room to be strict is regarding this area where Sarah was discussing with taking, I've got a sore throat, I want to take a pill, or I'm taking a vitamin, or I'm taking a supplement. But when you're talking about prescription medications, most of those, if not all of them, do not have a pleasant taste, and you're being prescribed by your doctor. One would not need to find a hechsher for them. They're bitter, you just take them. If they are sweet, then again, I would say you can follow the position of Hacham Ovadia or of Moshe Feinstein and just swallow them, because it's not the way of it's not the way of eating.
Thank you.
Okay, excellent. So now let's jump into toothpaste. Now, toothpaste, one is not doing so for, yes, we don't want to have gum disease, and we don't want to have plaque, we don't have fillings, but it's not necessarily medication specifically. So what do I do there? And again, in Israel, very easy to get kosher toothpaste, but here in America, hard to get kosher toothpaste. The other thing to be careful about is, do you know the number one, I didn't know this till I was reading this, I mean, I knew it and forgot about it. The primary ingredient in toothpaste is actually glycerin, which is often from non-kosher animals. However, glycerin, which is then mixed with other substances that are often inedible. Thus, the poskim must determine whether one may be lenient than in a standard case of a mixture containing non-kosher. Because there, I'm going to break it down to something which is inedible. Rabbi Yaakov Kamenetsky suggests that all toothpaste was permitted because the glycerin was combined with inedible substances, in which case you can follow the majority, which consists of kosher ingredients. However, the OU notes that this particular reasoning may no longer apply to toothpaste in the manner that it's currently produced. Let's have a look at this in source 15. He says the most kashrut sensitive ingredient found in toothpaste is glycerin, which is often animal based and usually makes up 1/3 of the product. Unquestionably, glycerin without a hechsher should be assumed to be non-kosher. Nevertheless, Rav Yaakov Kamenetsky in his Emet LeYaakov writes that toothpaste containing glycerin were permissible since the primary ingredient in toothpaste was calcium carbonate, which is inedible. Rav Yaakov reasoned that the requirement of requiring 60 times the amount of heter in proportion to the isur, what's known normally as bittul bashishim, does not apply because it's not a food item. And since calcium carbonate constituted a majority of the paste, the glycerin would be nullified based on the principle of batel barov. Nevertheless, the manufacturer of toothpaste has changed since Rav Yaakov's psak in the early 20th century. Calcium carbonate generally is no longer used, and the most common abrasive today is hydrated silica. And hydrated silica is also inedible, but usually only compose 1/5 of toothpaste. Therefore, the majority of raw materials in toothpaste are edible, and therefore I might say that Rav Yaakov's heter no longer applies. But there's another potential lenient consideration, and that is the concept of noten ta'am nifgam, when it gives out a negative taste. When something has a negative taste, then I can say noten ta'am nifgam mutar. This is based on the Gemara in Masechet Avodah Zarah 68b. It says here, Amar Rava, Hilchata, the halacha is as follows. When a substance which is forbidden gives out a negative taste, noten ta'am nifgam, mutar, it is permitted in a mixture. And that's how Shulchan Aruch says this. Kol davar sheta'amo pagom, anything which has a yucky taste, eino oseh taruvato, we do not permit it when it's in a mixture. Afeilu ein tamo pagum machmat atzmo, even if its flavor is not contaminated on its own. שבפני עצמו הוא מותאם ומשובח, and on its own it's tasty and flavorsome, אלא שפוגם תערובתו, it's only yucky in a mixture. Even in that case, we say it's mutar. And this contamination does not need to contaminate it completely to the point that one would be disgusted to eat it, even if it contaminates it a little. Afilu pogem katzat, eino oseh taruvato. It does not forbid the mixture. V'yesh mishomer, but there are those who say this is only when a small amount of prohibited substance is mixed with a large amount of permitted substance. But if a large amount of prohibited substance is mixed into a small amount of permitted substance, and even if it is half and half, we do not say that it is contaminated, it's permitted until it is totally contaminated, such as it is inedible for humans. So we're saying on the stand, the regular position of Shulchan Aruch, even if it's only a little bit of a problem, it's fine. But there are those who say, if it's only a little, then we have to be careful. They have to make it completely inedible for humans for it to be permitted. Rav Tzvi Pesach Frank uses his consideration as part of his basis for ruling leniently regarding toothpaste. He says, toothpaste, come on. No one's eating that. It's yuck. Even if it does taste, even if you have a nice flavor, no one's going to be eating toothpaste. So he says here, but when it is mixed in with a permitted substance, that even if it is a large amount of prohibited substance mixed into a small amount of permitted substance, one should still be permitted to eat it. When it is a mixture, it is nevertheless permitted according to all, since they did not enact a decree in case of a mixture. Our rabbis did not say when you mix these two together, they never said that would be forbidden. Therefore, in our case, one can permit it since there is only tasting without swallowing. Remember that toothpaste, what were we told when we were kids? Even if it's a nice flavor, you spit it out. And therefore, since I'm just tasting it and I'm spitting it out, ulam v'nidon didan, where there's only taste and there's no swallowing, I should be permitted. And therefore, since it's only rabbinically prohibited, and since I'm only tasting without swallowing, that is why toothpaste is permitted. And Rav Shlomo Zalman Braun also discusses the issue of in his She'arim HaMetsuyanim B'Halacha, and he seems to accept Rav Pesach Frank's leniency. And you can see that there, as it says in the bottom line, therefore it is permitted to use the toothpaste. Okay, and Rav Henkin also permitted toothpaste for similar reasons, though he maintained that the leniency does not apply to glycerin, but only to other non-kosher ingredients. Okay, the OU notes that even if Frank's leniency is accepted, it is unclear whether it still applies today due to the presence of many flavors within toothpaste that makes it more edible. What about children's toothpaste? Can I make that same leniency? And again, this is the problem. You get a lot of these really cool flavors out there. Does that change the situation? Should we just be buying the regular plain toothpastes, the spearmint type flavors, or are we allowed to have watermelon flavors or these other things that you can find? Or should I only get watermelon flavor if I am in Israel, for example, and bring it all back with me in my suitcase? Says the Chikor Mamtakim, if they are available with a hechsher, why not use them? So therefore, obviously, if you can get a hechsher, get it with a hechsher. What about when there are none with a hechsher? He says, "Tzarich lizaher shelo livloa." One needs to be careful not to swallow them. Mishum she'omrim b'minta yesh katzat hana'ah. Because what's the problem? Even if it's a mint flavor, I'm going to enjoy it. So therefore, make sure to taste it. So make sure to brush your teeth. You can taste it, but don't swallow it. What about mouthwash? Okay, and I'm quite partial to mouthwash. Is that okay, especially if I'm going to enjoy the swishing in my mouth before I spit it out? Rav Menashe Klein, in his Shut, his Mishneh Halachot, says, concerning his question whether it is permitted to rinse one's mouth with something that has a forbidden substance. For example, we know it has glycerin in there. You see, by the way, have a look there in the how they spell glycerin in Yiddish. Glycerin. I love that. I love Yiddish translations, transliterations. Glycerin. The Har Tzvi ruled that it is permitted to use toothpaste that contains a forbidden ingredient mixed in, because once it has been contaminated, once it's become pagum, there is no prohibition of tasting it. And he wishes to know about mouthwash as well, since most of them have a fragrant flavor. And he says there, if it has a fragrant flavor, is a good taste, tam tov, even though people do not usually eat them, nevertheless, since at the time that one tastes it, one benefits from the prohibited substance, it is forbidden to benefit. One should certainly not use it lechatchila. But he says it may be forbidden even according to the strict halacha. Therefore, in my humble opinion, one should not be lenient. He's actually very strict with mouthwash and says you should be careful not to have it. But the OU, and good you like to read the footnotes here, he says, what are you talking about? If you are allowed to use toothpaste for the same reasons you want to be lenient with toothpaste, you can be lenient with mouthwash. And that is how I rule. So don't worry, I'm not changing my practice with my mouthwash. I enjoy the mouthwash, but I certainly do not drink it. So you take the mouthwash, you swish it around, you spit it out. One does not need to be worried if it has glycerin or anything else in it. It is totally fine, at least lefi aniyut dati. So now what we have done in tonight's class, we have covered medications. And we've even said for medications which are prescription, absolutely, you take them no matter what. If it's something over the counter, which you can get kosher, get it kosher. If it's something you can't find with a hechsher, for example, what Rubisa said there about these medicated cough drops, you can take them even without a hechsher, even if it has a nice taste, since the primary thing is the medication. And with toothpaste, since it's mixed with things which make it pagum, you can have it even if it has a nice flavor. However, if you can use a plain toothpaste, better. And for the kids, watch them carefully. You don't want your kids to know that your kids are swallowing toothpaste because it's not good for them. It's very bad for them. And also you want to be careful about them having non-kosher, ingesting non-kosher food. So therefore, if you're not got a concern about actually ingesting it and you're just rinsing it or brushing your teeth and spitting it out, absolutely no problem whatsoever. So any questions on toothpaste or back on medications? All right, friends, that's all for tonight. Have a wonderful evening.